first, let me start by saying at our magazine Sepid Donai, we've been trying to introduce Iranian psychologists to people, important ones who have accomplished important goals. And from this issue we have decided to take a look at foreign psychologists too. And for the first one, we decided to go with the most famous and the biggest one, Sven Hayes. So that's why we're here.
گفته میشه که نظریه شما بخش زیادی از قواعد بنیادی روانشناسی رو به چالش میکشه. با این نظر موافقید؟
Um, it's been said that your theory challenges a lot of fundamental rules and disciplines of psychology. Do you agree with that assessment?
Well, yes and no. Initially, when ACT became popular, it was seen as a big challenge to cognitive behavior therapy, which is the tradition that in the United States at least, and around the world really, has been the most focused on evidence. And cognitive behavior therapy came from behavior therapy. I'm old enough to have been part of the behavior therapy tradition and to see the change to CBT, to cognitive behavior therapy. And I thought it was progressive to try to really understand more about the human mind and include it. We are not just non-human animals. There are many things we can learn by studying non-human animals, but it only takes you so far. And behavior therapy was based on principles of operant and classical conditioning that were, that apply to all complex organisms. But what we're doing right now, what you and I are doing, is not what the bird is doing outside the window. It's fundamentally different. And so cognition needed to be, human cognition, higher cognition, needed to be part of it. But I was very concerned that we were breaking away from a laboratory science and then getting principles that were highly refined and precise that you could apply to humans. And instead, we were using more of lay theories or theories that just came in the clinic. And so what happened with CBT is the theory of cognition was, I thought, inadequate. I then had the great fortune, this is a long answer, is it okay? This will be about a 5-minute answer. I had the great fortune to develop a panic disorder. I'm not sure how my life would have gone had that not happened, but I was blessed with it, really. And it made me really look in a very fundamental way at my own life. I've given a TED talk, a TEDx talk, explaining the moment where my life really, really turned, where I had kind of an out-of-body experience, you could say a spiritual experience of catching that I was following a voice in my head that was telling me that I had to run from my own thoughts and emotions. And instead, I knew in that moment that what I needed to do was to open up to my own experience. And that changed the course of my work very quickly. We did 3 randomized trials, one with weight, one with pain, and one with depression. And the one with depression we did with my student who is studying with Aaron Beck, who's now the father of cognitive therapy, almost 100 years old, really a main figure in CBT. We did it right at his center, and what now is called ACT did a little better. I published only one of those studies to help my first student, get his job, and then I went for 15, 16 years trying to figure out why. Even developing a theory of cognition that now has several hundred studies on it, not just about ACT, but that can be used, for example, to help do language training with autistic children, or to develop a sense of self in children who don't have it. So when I came back then and finally presented what we had learned on ACT, and we started to do randomized trials. At that time, we had only 4. Right now, we have 360. This was in 1999. It shook the foundations of CBT. And then when my first popular book, Get Out of Your Mind and Into Your Life, was published in 2005 and written up in Time magazine in a 5-page story, and I suddenly had my 15 minutes of fame. The reporter cast it as a war between CBT and ACT, and a war specifically between Aaron Beck and me. But Tim Beck, we call him Tim, has been a hero of mine. I sent him my first student. He's a giant. I think some of his theories are wrong. I think we now know that they're wrong. But that all scientific theories are wrong. We just don't know where yet. That's how science works. So now, I'll draw this to a close. Now we can look at what ACT has done 20 years later. And it's not just ACT now. There's a whole third wave of CBT, dialectical behavior therapy, mindfulness-based cognitive therapy, metacognitive therapy, functional analytic psychotherapy, on it goes. And what we now know is the processes of acceptance, cognitive flexibility, and what we call cognitive diffusion, greater attention to the now from this more spiritual witnessing sense of self, focusing on your values and building your behavior around that. Those things. Psychological flexibility is what I call it, those 6 things. Those processes are in not just ACT and the third wave, it's in some of why CBT worked, behavior therapy worked, but it's also inside humanistic views, existential views, systems views, psychoanalytic views, and I think one reason why it's landed so strongly in the Islamic world is that it's in our spiritual and religious traditions, very clearly in the Abrahamic religions, but in almost all major religions. So the reason I hesitate is I would say, yes, it's very different in the sense of we're no longer focused on trying to detect, challenge, dispute, and change our thoughts, which focuses our attention exactly on the weakest part of us. Thoughts are never erased. We're historical beings. You only deal with them. If you ever heard some horrible prejudice story, it's in your head. It's not going to go away. The very fact you hate it means you remember it. It's influencing you in your dreams. It's moving things around. That's what it's like. So we have to bring our full human ability to notice what our mind is doing, notice what our bodies are doing, notice what our emotions are doing, and bring this more observing, noticing sense of self and be able to deal with that, to bring our attention to the moment, but then to what we really care about and building our life around it. And when we do that, it turns out that ACT is resonant with many of the deeper clinical traditions and with our wisdom and spiritual traditions. So it's was perceived as being very different. I think right now the whole evidence-based therapy wing of psychology, this will sound arrogant, please forgive me, has moved very strongly in an ACT direction over 20 years. And it's evidence that's made that happen. So CBT is no longer CBT. CBT includes now as a central core these psychological flexibility processes and principles. And to me, that's how a scientific tradition should work. If we end up where the religious leaders were, the imams were, our spiritual traditions were, so much the better. Isn't it a good thing? We can bring Western science to simplify, to focus on what's most important, but we shouldn't be so arrogant to think that we're creating things that are brand new. We're discovering things that human beings have been dealing with forever, and finding new ways to put them in the modern world. I'm sorry for answering so long, but you asked a good question.
Yes, that was a good answer.
اینو به گفت که برخی روانشناسان از جمله جاناتان کانتر گفتن که شما همکارانتون ادعا میکنید که روانشناسی بالینی در تلاش‌های خودش برای کاستن از رنج بشری ناتوان بوده بدون اینکه اویدنس بیس قابل توجهی
اینو
داشته
جاناتان
باشه.
کانتر اینا اویدنس ندارن یعنی.
نه، اینا اویدنس بیس ندارن، یعنی در این ادعا
یعنی اونایی که این ادعا رو علیه اینا میکنن اویدنس ندارن. Some psychologists like Jonathan Conter have been claiming that you and your colleagues have basically in clinical psychology and in the traditional form of it have kind of failed in your efforts to decrease the sufferings of human beings, and of course they don't have enough evidence for this, but that's what they're claiming against you. In their meta-analysis, they're claiming that it has failed to reduce human suffering.
Well, I think Western approaches to human suffering have clearly failed, because what we've done is biomedicalize human suffering. But it's, I think, what we're doing in the ACT wing and the process-based therapy wing is a way forward. If you look at what has happened in terms of global health, of some of the real heroes there, people like Vikram Patel at Harvard, who was in India for many years and now is at Harvard, who really documented when you bring full syndromal thinking. Syndromal ideas is that, signs and symptoms will lead us to latent diseases, and that most human suffering is a latent disease of different kinds. And that as soon as you do that, in the West anyway, people feel initially, oh, this is very good, it's not my fault. But then within minutes, they're thinking, but my horizons now are not so extensive. They have to be drawn in. They're immediately thinking, I have something that can only be treated with medications. And the medications that we have are very nonspecific. They produce enormous changes in the human body, some of which are permanent. If you suddenly engulf your body in serotonin at levels that never were seen on the planet before, your body reacts to that. It does not want to see that. It tries to maintain homeostasis. So you start down-regulating serotonin or dopamine in the case of so-called antipsychotics. And on it goes. And when you do that, sometimes these effects last for the rest of your life. Never mind the side effects. And with antidepressants, 60% of the people have sexual side effects. This is, in the U.S., 1 out of 4 women last year were on antidepressants. 1 out of 4. This is insanity. It's insanity. Yes, antidepressants can be helpful with severely depressed people for a limited period of time with a good rationale that gets them also to use psychosocial methods that have good long-term outcomes with far fewer side effects. So yes, as a help, as a bridge, but not as a permanent flood of neurotransmitters at levels your body never evolved to deal with. So I think Western biomedicalization of human suffering has been harsh on our bodies and on our hearts and our minds. And here's the way I think. They say 1 out of 5 people have a mental illness. 5 out of 5 people have mental health problems. Everybody. Because it's hard to be human. Don't biomedicalize that and create a little compartment and shove people in there. In the 50 years we've been trying to find a latent disease, there's not one single example. The last one is general paresis, which is untreated syphilis, and everybody knows how to treat syphilis. So even the NIMH in the US turned away from this 10 years ago and went to what they called research domain criteria, no longer organizing randomized trials targeting DSM, Diagnostic and Statistical Manual of the American Psychiatric Association, targeting those disorders. So whether it's the ICD or the DSM, it's the same poisonous idea. It was okay as an idea, but to try. Maybe it would have worked. Signs and symptoms leading to syndromes, which are just collections that then would allow the researchers to find the underlying cause. But 50 years is enough. Billions and billions of dollars is enough. And I think now we need to focus on how to bring processes that lift people up, that prevent mental health problems, but also empower prosperity. So if someone is saying, well, but we haven't alleviated human suffering in the sense that our net cultural weight is increasing, not decreasing. I agree with that. But the cause of that, I believe, has been a bad idea, a possible idea that could have been good, taking over so much that it's buried us in what turns out not to be a good idea. In the United States, 60% of the people last year who had some sort of mental health problem received medications only. Nothing else. Just a pill bottle. Nothing else. 60%. 30% received the pill plus at least some human contact, some effort to change your life, to change your practices, to change how you relate to emotions and thoughts. 30%. Less than 10% psychosocial only. And if you go back just 10 years ago, those numbers were far smaller. If you look around the world, every single society that has done this, all the mental health problems have gotten worse. So to me, enough already with that. And I agree with the assessment. But I would say this, look at the randomized trials of self-help even, of apps, websites, books, peer support groups that focus on the processes that either entangle people or lift people up, and they're very good outcomes. We've done studies with our self-help books, for example, that show that you get 60-70% of what you get from a course in psychotherapy if you do the books carefully and you do all the exercises. So to me, that says we do have a way forward that will reach the whole culture and lift it up, which is that we have to be wiser and put into our magazines, our newspapers, our clinics, our schools, our churches, our mosques, our culture, the scientifically proven processes that liberate human beings. And by the way, when you do that, you're not going to feel that it's foreign, because you'll find that it's inside our wisdom traditions, our spiritual traditions. It's inside our best cultural traditions. When I talk to people about ACT and the metaphors we use, the stories we use, I always say, don't literally translate these things. You find a story in your culture that makes the same point, and people can always do it around the world. And we've looked at, this is about to end, but this long answer, we've looked at the psychological flexibility, those 6 things of emotional flexibility, cognitive flexibility, attentional flexibility, from this spiritual sense of self, focused on values with behavior linked to it. Those 6 things. It predicts health outcomes in every single culture where we've tested it, including your own. Many, many studies, as you know, because it's a very popular form of or target of research in your country. But those principles are not foreign to us. They've just been buried in the modern world. So let's find the ways to put them in people's hearts, their heads, and their hands, of knowing by personal contact that it's of importance, understanding why, and learning the techniques, the methods to be able to actually put it into your lives. And that, to me, will give us a better answer to the pervasiveness of human suffering by going from problems to prosperity with the same processes that are vetted by Western science, but put into the culture and into the community in any ways that you can. I will end with just one example. In the U.S. military, the chaplains who are from any religion, there are many, many different religions, including there are good Muslim chaplains in the U.S. military, as you may know. They were asked to decide how they would connect with evidence-based psychotherapy practices. And they did a research and they decided on 3 things: problem-solving therapy, motivational interviewing, and ACT. And I've written a book on how to put ACT into pastoral counseling and clerical care with chapters from all the major religions, including Islam. So there's an example. Can we not put mental health, modern mental health advice, right inside our spiritual and religious traditions? And yes, let them modify it. Tell the stories out of the scriptural traditions. Don't think that it's going to be found in a pill bottle. People's hearts will be and lives will be lifted up by learning how to do healthy things, and the science can help us know why and how, but it needs to be fitted with the human needs that we find. And I think we went too far down this road of thinking that human suffering was a disease.
Some empirical studies that have been published have shown that ACT in therapy sessions don't show much difference with other disciplines, other approaches. And Stephen Hoffman believes that is ACT is very much like muritotherapy. What would you say to that?
It's very funny that you would use Stefan as an example, because Stefan is probably my best friend, Stefan Hoffman. Could I tell that story briefly, and then I'll answer your question?
Of course.
In the early days, when ACT was viewed more because of what reporters were doing than what we were doing, that ACT would look like it came to burn down the house, to take evidence-based therapy and rip it into pieces, to challenge CBT. Stefan, who is a major CBT person and has won the Beck Award and so forth, wrote some very, very critical articles about how this is old wine in new bottles. Really, it's Morita therapy. I didn't even know what Morita therapy was. I had to go look it up. But it does have some overlaps, as it does with many of the clinical traditions and spiritual and wisdom traditions. Well, what I did was I invited Stefan to come to our conferences. And I said, come to our conferences and we will give you the full stage. Tell us what's wrong with what we're doing. And he came 11 years ago, gave a very tough address, and we were very happy to hear about his criticisms. But we also engaged him, said, come, listen, let's have a conversation. And we got down to some of the philosophical differences, the theoretical differences. Over a period of a few years, Stefan started becoming interested. And then, I didn't mean to tell this long story, but he was part of a group that invited me to give a talk in Germany. I went, I gave a talk, and I fainted on stage afterwards. It turns out that I had an arrhythmia in my heart that I didn't know about. That now is controlled, it's all fine, but I fainted on stage. And I was put in the hospital and my heart was going crazy, and they couldn't figure out why. Who shows up next to me but Stefan Hoffman? And he sits with me until 2 in the morning. He has talks to give the next day at this conference. So, I thought, this is a good human being. He's criticizing me. Let's have a conversation. It's gone on. So now, if you look at my current work, if you just went to Google Scholar, clicked on the year and look, you'll see about a third of my publications over the last 2 years have been with, or maybe a quarter, with Stefan Hoffman, the person who said this is nothing new. What we've dug down to is there is something really new here. It's this focus on principles and processes, and the processes that we spent those 16 years developing before we went from my initial trials that came out of my initial transformational experience of finding a way out of my own panic disorder to the now writing it up in a book and showing some of the basic science at the level of principles and measures. Those things are now at the core of what Stefan and I are doing, which is to try to turn CBT into what we call process-based therapy, of taking all the evidence-based processes. We just finished, we won't publish it for another year because it's very complicated. We've been working for 2 years. Stefan Hoffman and I and a colleague in Australia, Joe Sorochi, of reviewing the processes of change of every randomized trial that measured them carefully and used this statistical procedure called mediation, which is how you know that something was a functionally important pathway of change. Every single psychosocial intervention study ever done in the history of humankind. 55,134 studies claimed they had found these things. We reviewed each one twice. Over 110,000 ratings. Took us 2 years. Just last week, we broke out, finally, the studies that did it properly, which was about 900 findings of those 55,000 studies. If you look at the processes of change, what really is important to outcomes, psychological flexibility and its 6 elements will pick up about 40% of that. If you then add in the other ones that are close, that are very similar, for example, anxiety sensitivity is an older idea, but anxiety sensitivity is really a measure of, do you run away from your own anxiety when you feel it? This is very familiar to ACT. You add that up, more than a half of what we know about in terms of psychological change fit within our model. So let me cut down to what I'm saying. If you mean, does ACT produce significantly better outcomes in, for example, depression than traditional CBT? They're very close. The meta-analyses sometimes show a little advantage for ACT, probably about a fifth of a standard deviation. But that's very small. But if you look at the processes of change that matter, they're very dominantly the ones ACT are pointing to, number one. Number two, if you look at the breadth of the applicability of that same model, it's much larger. So for example, you can't take CBT for depression and help your athletes win gold medals. People have won gold medals at the Olympics with ACT coaches. You can't take CBT for depression, for anxiety, for panic, and put it inside your business and get a more successful business. There's been dozens of trials with huge companies showing that you can put ACT into your boardroom, into your group of stockbrokers, into your call center employees, and get less stress, but also more engagement and better outcomes, better business outcomes, better service to customers. I could go through this, like if you know, with cancer or stepping up to trauma, with what happens when there's a storm in which people die. In your own country, you have very nice trials showing what happens with soldiers who were sent to war, especially in the war that you had with Iraq, and what has helped them deal with their trauma. The pre-deployment of soldiers, not post-deployment, before they go, what helps them be more resilient. I can go on and on. So here's my point. The best evidence-based therapies are pretty good. ACT as a model takes it and expands it out to almost any area of human functioning, and the same model works. The same methods basically work. And you can individualize it. So I'm not here chest thumping saying, oh, ACT is the best. I'm saying we're on a different journey of not which is the best protocol for these latent diseases, but rather what are the smallest set of processes that we can focus on that liberate human beings and empower them to live lives that are full of prosperity, contribution, love, compassion, that are full of what we would want human lives to be full of, yeah? And there, I would say ACT has more to contribute that's evidence-based and proven with its, yes, 350, 360 randomized trials, including about 40, 45 out of your country. It's the second most productive country in the world in terms of ACT randomized trials is Iran, yeah? But not just that. The 3,000 studies or so forth on the underlying basic theory of cognition, relational framing, which we haven't got into yet, and the psychological flexibility model, and how to apply it to individuals. So let's go away from shoving people into boxes and saying, oh, you're major depressed, and then putting a book on top of them. Let's look at people more as individual human beings. What are the processes that they need? And that's the journey Stefan Hoffman and I are now on. And if you read our current articles, you'll see that we have a very different agenda for all of evidence-based therapy. And I'm proud to say that ACT led the way on that. And Morita therapy is fine. There's a few people in Japan who still get it. But it's 100 years old, practically like 70 years, 80 years old. And no, it didn't change the human condition. But we're on a journey where maybe we can marry up deep human wisdom with Western science and empower our normal people. What I mean by normal people is not people who don't have syndromes. I mean people who are maybe not so educated, who are maybe not so psychologically sophisticated, but who care about their families and love their children and want to have a job that matters. Can we put evidence-based psychology there? And I think we're on a journey to do that, and we're making progress. Can I give you a concrete example? Just one. Go to the World Health Organization trial published in Lancet Global Health of Self-Help Plus. Just, you can Google Self-Help Plus, came out in the last few months. With the crisis, the COVID crisis, the intervention, the World Health Organization just released on its website 3 or 4 days ago for people around the world to use to help step up to the challenge of the virus. Okay? Self-Help Plus is ACT. It's just ACT. But where was it deployed? It was deployed with South Sudanese refugees in Uganda. People who are sitting on dirt, who have nothing, who left with nothing but their clothing and their children. Yeah? And with a cartoon book, because many of these people are illiterate, a cartoon book and an audio tape played by indigenous health workers, people who may have less than a high school education. They're there to help people, take their vaccines and, things of that kind. So not sophisticated psychologists. Very nice randomized trial done by the World Health Organization showed that normal folks improved with not just any one syndrome, but the broad range of things that would happen if you suddenly were uprooted and put in another country with nothing but your clothing and your children. That it met the level of what you'd get in the developed world in terms of impact that you'd hope for from a broad intervention like that. A cartoon book and an audio tape. And if you want to see the cartoon book, you can go to the World Health website. It's now being deployed around the world by the World Health Organization. Well, that's because of ACT's focus on principles will go all the way to illiterate people sitting in tents with nothing. And I'm very proud of that. And I think the idea that evidence-based therapy could lead to that is wonderful. And it's just an example of many, many trials like that. So I do think we've made progress. But the Western world and the developing world are going to have to wake up to the dead end of biomedicalizing human suffering. Yes, you need medications sometimes, but much more you need healthy psychological processes being put into everything that we do.
Okay, thank you.
You can see I give long answers. I'm not a good interviewee.
No, it's great.
I talk. This happens with old men. Have you noticed? I'm turning 72. You ask me a question, I talk.
It's great.
All I need is a rocking chair and a porch.
علیه اکت و جنبش مثالی‌نویسی شما حافظان واژه موجودی می‌خواهید سرمایه‌داری و رهبران همچنان به تاخت تاز خود مردم علت نشون دادن از سرمایه‌داران و حکومت‌ها که ذهن خودشون بدارن.
A very, I guess I should say popular, a very common criticism that, and it was interesting that in the beginning you mentioned like right-wing people protesting and Trump and everything, because like people who are from the left wing of the political spectrum, I guess, a very common criticism that they have against ACT and against the positivist movement by Seligman is that they become like protectors of the status quo, and they
Yes.
want capitalism and its leaders continue uh, continue on with basically ravaging the society, and for the people to not blame the capitalists, not blame the governments, but blame look for the problem, like, feel like the problem is in their own mind instead of in the outside world, in the leaders. I guess what would your response to that would be?
It's a fair criticism of Western psychological approaches. I do think it's to some degree a fair criticism of positive psychology. I'm sorry to say, if he reads this, he'll be appalled, but I think to some degree it's a fair criticism of Marty's work, Marty Seligman, who I've known for many years. And I'm mindful of the fact that, for example, Marty actually got entangled with the torture work. He was actively training the military during the Bush era as to how to torture people. And some of that came from, I think, this confusing set of things. But now here's, from an ACT point of view, I think it's very unfair and improper, and I have evidence to show that it is. Several things. If you look at the first randomized trial done in the modern era, when we come back after our 16 years of silence, because we're working on, not silence, but silence in randomized trials, because we're working on processes, measures, philosophical assumptions, and components. It was done by Frank Bond and a colleague of his named Bunce with call center workers, comparing teaching workers to take charge about the stressors in their environment and change them, or working from a psychological flexibility point of view. It looks like a classic example of what you're talking about. Here we have a very oppressed group of workers being asked to do something that's ridiculously hard, of over and over again calling people about the bills they don't pay and so forth, getting hung up on, this is not a job you'd want to do. And here we've got, we'll deal with your stress versus let's change the environment to be less stressful. Okay, those are the two. Here's what happened. In terms of stress, ACT was better than the change your environment approach. In terms of changing your environment, at post-treatment, targeting that was better than ACT. At follow-up, ACT was better than targeting it. Why? Because people started demanding changes out of the values-based action that is in the ACT model, with the emotional flexibility skills to do scary things. What keeps people small? What keeps people from coming together and saying no to abuse, to these excesses, I agree, of capitalism, absolutely. I think some of these are psychological barriers. And for us to then step forward in ways that are effective, because be careful. I mean, just people on the street saying, can also lead to violence, can lead to self-righteousness, can lead to divisions. You with me on this? So is there a way that we can come together in community in a values-based way, not in an us and them based way, and to rein in selfishness and to focus on the good of people, even in how we run our governments and how we run our economies and how we organize our businesses and even that. So what you have seen in the ACT community is over and over again these kind of vigorous pro-social attempts. I'm going to give you one example, and then I'll explain where it went. We had a clinic in Sierra Leone that was funded largely by ACT charities called Commit and Act. If you Google the words Commit and Act, you'll find the website for this clinic in Bo, which is the third largest city in Sierra Leone. One psychologist in Sierra Leone. One psychiatrist. 6.5 million people. So basically nothing in terms of mental health, okay? When we opened the clinic there, the people literally had a parade. It was so important. Okay, so then here comes the Ebola crisis. And the West starts doing all these crazy things, like in our country, our crazy system, people were even quarantining people from any place in Africa. I mean, it was just so unkind. But also in Sierra Leone and so forth, UN workers were attacked. Some of them were hacked to death with machetes by people who thought that these doctors in moon suits were bringing the disease. Yeah? Well, Google the words "kiss the banana trunk," or look at my blogs on Psychology Today and you'll find it. What we did is the director of the clinic in Bo, Hannah Bakare, was appointed because it was the only organization in that city, director of the Ebola response. She was just an ACT clinician. But she used ACT to go to the people themselves and find out how are we going to organize ourselves to do this challenging thing. And it was combined with a method called pro-social, which I'll explain in a second. And the people themselves came up with the idea of a ritual, because in their traditions they have to pray over the body, wash the body, cleanse the body, kiss the body. But if the person dies from Ebola, the virus goes to the surface of their skin. If you wash them, you're going to become infected. And so they had to commit a sacrilege. They had to allow the medical workers to come and put the bodies of their loved ones in a plastic bag, carry them away, and burn them. I mean, think about how horrible that is. And some of these people didn't even have a germ model of disease. They're illiterate. They don't understand what's going on here, but they do know that's a sacrilege. They came up with this idea: we'll cut down a banana trunk, we'll wash it, we'll cleanse it in the ritualistic way, we'll wrap it in a clean linen sheet, and we'll bury it. Okay? They created a ritual to allow them to engage in their religious practices without contaminating their communities. And they called it a reparation ceremony because it was an act of repair to the violation that they were doing to their traditions. Okay? You look at Sierra Leone now. Well, what happened, before I get there, in Bo, of the 13 districts that had a significant amount of Ebola infection back that last summer, the only one that stayed flat was Bo. All the other ones increased. And because the banana ritual exercise went through the whole district. And in the rest of, I'm going to tie this together quickly, but in the rest of Sierra Leone now, the culture has been pulled asunder by forcing people with guns to violate their traditions. And there's domestic violence, there's drug addiction, off the charts, as a result of Western doctors coming in with the military. And yes, they solved the Ebola crisis, but they ripped the culture into shreds. And so that's not true in Bo. In Bo, the ACT clinic has become even more central, and Hannah Bakare is being given serious thought to run for president of the country. The ACT person there. Now, coming back to your point, when you empower people to be more open, emotionally more aware, more connected to others, to take acceptance, turn it into compassion, to take diffusion, noticing your mind, and turn it into really listening to other people's opinions, without reacting so quickly and come to mutual understanding. When you take this sort of more spiritual sense of self and you use it to connect, as I am connecting with you, seeing thousands of miles away, human eyes looking back at me. And then you connect all of that to values-based action. You empower people to step up. So what we've now done, if you get the book Pro-Social, I've joined with people who are putting Elinor Ostrom's Nobel Prize-winning design principles for the economics. She showed that indigenous peoples have been solving the problem of the tragedy of the commons. Have you heard? Do you know that story, the tragedy of the commons?
No.
Where there's a commons area where you can graze your cattle, let's say, and so each farmer says, oh, okay, well, if I have one cow, that's good. If I have two, that would be even better, or whatever their animals may be. And then if everybody does that, the grass is overgrazed and everything dies. Okay? Called the tragedy of the commons. And in traditional economics, it can be solved one of two ways. Command and control. The government will tell you what to do. The other way, invisible hand, private ownership. Both of these models do not fit humanity. None of us like being constantly told what to do. And it is not true that we're inherently greedy and selfish. It's a lie. It's not true. And yes, capitalism built on this, at its worst, sick ideology that greed is good. And what we went through with the with the communism and so forth, turned into, it sounded very good, but turned into this top-down, I'll tell you what to do society. Well, what Lynn Ostrom won the Nobel for in 2009 was showing that the way it really works is that people work together in community to take care of each other and cooperate. How do they do that? You restrain selfishness and you promote cooperation. And she came up with 8 principles for how to do that. So we've combined psychological flexibility with Lynn Ostrom's Nobel Prize-winning core design principles. And I went and spent time with Lynn Ostrom to help design this program with my colleague David Sloan Wilson. And we've now produced a protocol. That's what we put into Sierra Leone. It wasn't just ACT, it was ACT plus the core design principles. That's what led to the banana ritual. That's what's led to the Uganda trial that WHO just put out. So that's not capitalism, and it's not of a traditional sort, but it's not command and control. It's something more like what tribal societies have learned to do, but now expanded to the point where the tribe is all of us. In the condition we're in now, if global warming happens, it's all of us. If COVID happens, it's all of us. A pandemic doesn't care about your national boundaries, your religious groups, the color of your skin. It does not care. So I think in the same way, we need to create a modern world in which we do what we've done through all of humanity of finding a way to cooperate and build an economy based on that. And if you want to explore that, you'll find that it isn't just her winning the Nobel. These principles are going into countries around the world, into Norway and other places where they're trying to empower groups to come together, to cooperate, and to nest cooperative groups into groups of groups. And we have a program for how to do it. So it's a long answer again, but you are right. If you just take a psychological model and end there, and you don't have values-based action that extends to others, you can essentially have another variety of selfishness. one that drives me crazy that is in the third wave of CBT is mindfulness training without values. Mindfulness training is in all of our major traditions. This is not just Buddhism. It's the mystical wing. It's the Sufi wing. It's the mystical wing of our major religious groups. So don't call it mindfulness. Call it contemplation. Call it whatever fits. But if all you do is that, and you put that in the health system, there's no values in there. And then you get things like, you take care of the kids, I have to go meditate. What? Really? This is not what this is for. So I think you're right without the values piece, number one, and you're right without the social extension, number two. But you're not right about ACT, because from the very first study of the modern era, we've shown that you extend values with more psychological flexibility and you get pro-social action of groups. And we've now learned how to even build that out and foster it deliberately. And, we're trying to put this pro-social protocol around the world, and we're trying to put cultural change and rethinking how we do our business entities and so forth around the world using psychological flexibility as a core model.
In therapies that use ACT in Iran, in a more extended way by psychotherapists and counselors, um, a lot of the times there's no protocol, and uh, it's just based on their perception, their understanding, the therapist, from
Yeah.
mindfulness and acceptance and being in the present moment and committed act. And is there um, any um, would you say like any kind of like mindfulness that is being practiced and used by therapists, um, would it still be the version of mindfulness that you intended?
No, I don't think so. And there are so many protocols. People can follow the protocols, but the problem with the protocols is that you need, I think, to fit this to the individual. So we do have self-help books and things of that kind where people themselves can look at what that community around the world has developed. My sense, looking at what's coming from Iran, is that some of the best teams are doing ACT pretty well. Some of the trials are world class. They've published in PLOS One or places like that. Some of them are good, really good trials. But some of the clinicians are still learning. Let's say it that way. A big problem that I have is that it's hard for the Iranian community to fully participate in the world conversation. Some of that is English, but some of it is technology and the sanctions. For example, people can't even join the Association for Contextual Behavioral Science with a credit card with these sanctions. So that means it's very hard for them. Now, what we've done is we've created a scholarship. People should know. If you can find a way, and it's hard sometimes with internet filters and so forth to get there, but if you can get to contextualscience.org, we will give Iranian people, professionals, free membership, because we have a scholarship program to do that. We understand that it's hard to pay. I look forward to the day where I can have a normal conversation that really helps lift people up. So when I said no, here's what I meant. As I just was saying, you take something like mindfulness or meditation. In the wisdom traditions from which contemplative practice emerged and from which practices emerged to rein in the judgmental mind and to focus more on compassionate connection and the good of others, to focus more on your values. There's always a piece in there about the values-based action and putting it into practice. There are many things in the mindfulness wing that seem to be an end in and of itself. And that I don't think is good. There's also some elements in there that may not be good in other ways. I'll give you an example. Some of the breathing retraining that's in some of our wisdom traditions and our contemplative practice traditions. Turns out some of those are actually probably even harmful. Why? Because you very easily can create hypocapnia. You can very easily have blood that's too oxygenated and doesn't have enough CO2. I can show you the trials in which if you measure the level of CO2 in your blood, it predicts whether in the long run you're going to have further problems with anxiety disorders. But it's a weird quirk of the human body that when you're feeling very anxious, you want to take a deep breath. Sometimes that's exactly the wrong thing to do, but it feels good when you do it for a few seconds. And that's enough to capture you. You feel like you can't get your breath. In fact, the word anxiety in English came from an original root that meant can't breathe. It's probably the exact opposite. It's probably more like you're breathing too darn much. And so Western science can say, better be careful about this breathing retraining. You better have a capnometer, the actual measure of blood gases. They're not that expensive now. In the emergency rooms, they're expensive. There's consumer versions you can get for a few $100s that will teach you when you're doing breathing to also breathe in a way that doesn't put too much oxygen in your blood. Well, there's a Western science idea that, no spiritual leader 1,000 years ago could possibly have known about. They didn't even know about CO2. They didn't know about the circulatory system of the body. So can we find a way to put together these traditions in a way that gives the best of Western science, but also is respectful of what we know in our culture? And I think just mindfulness, period, end of story is probably better than just taking pills, period, end of story, but it should not be where we land, and I don't think so. Let's get into a larger conversation. And when I say what I just said to practitioners around the world, sometimes they're a bit horrified because they've never heard about that. And they've been telling their clients, take a deep breath, breathe from your belly, more deep breaths. Be careful. You may actually be producing long-term harm, not long-term good. So I think and you have such a strong science tradition in your country, when we're able to come back in a more normal way and be one world, I'm very much looking forward to having that conversation, being able to visit your country. I know I could visit your country now, but you would not want to live with what I would have to live with if my passport had Iran stamped on it. I would not be able to travel around the world easily, believe me. So it's a harsh time for our two countries, but to the people there who are interested in ACT, I would say, try to get connected to what's going on in the worldwide community, and yes, use these processes, but make sure they're constantly being updated, measured, and that they're being combined with our best available scientific methods in all of these areas. I gave you 2 examples. of making sure that values-based action is part of mindfulness, and being careful about some of the methods that may have developed before we had Western science checks on them, such as breathing training.
Thank you. Um, this will be our last question from you, and
Yes.
um, we're trying to like approach a more general, maybe, and at the same time contemporary uh, situation. It's been told that the goal of ACT is creating a rich and meaningful life,
Yes.
and of course accepting the suffering, the fact that there is suffering. Um, in our time, there is a lot of suffering for a lot of people around the world, as you have mentioned also, economics, and all the kinds of social, um, politics,
Yes.
and it's extending the concept of meaningfulness of life for a lot of people. It's increasing that idea, and now we are dealing with worldwide phenomena like coronavirus, and so that's on top of all that has just made it for a lot of people maybe too much. Um, um, I guess my question is, how can you live rich and meaningful in a time when there's a virus like this is ravaging everything basically, and a lot of people's lives are um, basically a lot of suffering.
Yes. And let's add to it, not just the virus, but let's add global climate change. I mean, this is thundering down upon us. Anybody with eyes to see who cares about science can look and say that your children are facing a much bleaker world if we don't do something. Certainly your grandchildren. And how can we just pretend that that's not true? So yes, I agree. But let me just say a few things. If you had to pick a time, if you were a baby not yet born and had to pick a time to be born, and you couldn't control where in the world, but only the moment, you couldn't do a better job than pick right now on any objective measure. There's less starvation, there's less violence around the world right now than there was 100 years ago or 200 years ago. I know it's horrific because we're so aware of how horrific it is. We see suffering around the world. You know, if anybody does anything really horrible in the next few minutes, or if they really want to shake the world, they can live stream horror. In our country, where we allow this insane amount of guns, people have put on their GoPro camera and gone in and shot people dead, live streamed to the internet. Okay? That's never happened in the world before. So our exposure to pain and suffering is off the charts. Our advancements in terms of human ability to control things like violence, disease, to extend our lifespan is better now than ever. So you have this paradox of the human condition, that we've been able to bring science and technology to grow more food, to talk thousands of miles away in real time. Think about this, what we're doing right now. It's amazing. You and I are having a conversation. 20 years ago, we couldn't do that. We'd have a hard time getting a phone connection. 100 years ago, it would be impossible. It would take months, or if not weeks, to even say the simplest thing, writing it down on a piece of paper and putting it on a ship. So don't give up on humanity. We have the capacity. But we also have the capacity for evil. We have the capacity for selfishness. We have the capacity for harm. And so I look at what we're doing around the world. I see you wearing a mask. You see me sheltered in place in my home. Do I want to go outside and have fun and take my kids to the lake? Yes, I do. But I'm here. Yeah. Why? Not because I'm afraid, but because I care about others, and I don't want to inadvertently either get or give this terrible disease. So here's my message. You said suffering is universal. I'd actually say it a little different. Pain is universal. Suffering is optional. If by suffering we mean the place in which this is too much or we can't carry it. The metaphor of suffering is underneath carrying. The fur part is from a Latin root that means ferry, like a ferry boat. To carry, like the same root as reference, the ferry part. The suff part is a prefix that means up and under. So suffering is like carrying a heavy weight. I'd say let's help learn how to put down the weight. Yes, you're going to die. You are. Yes, you will lose your functioning if you live long enough, very likely. You'll certainly lose your friends if you live long enough. You'll see bad things happen. That's going to be painful, yes? But it's not going to crush you if you come into the world and see that your pain links you to your purpose, that your capacity to see suffering in yourself helps you see the needs of others. So, knowing that you're going to die asks you to take this moment and live it to the fullest, to bring your whole self to it. Yeah? So, I think pain is universal, suffering is actual optional. I think that's an invitation of the mind to say no, when all of our wisdom traditions, spiritual traditions, and deeper clinical traditions are about learning how to say yes. So let's say yes to life, the full embrace of life. That's like a rich soup that includes many flavors, and some of the flavors are loss. Love and loss comes as one thing. It's not two things. When your baby's born, you cry at the sight in part because it's so wonderful and so sweet, and because there's that poignant quality that you know that this little one is going to have to go through the same things you went through. A painful process of learning how to grow. When you watch a wedding and you cry, it's because you see the sweetness of commitment. And if you've been around long enough, you know it's not going to always be that easy. And so it's courageous, yeah? And it brings tears to our eyes because it's not sugar